to create maximum safety. This is not a time to let up, despite the fact that there's better and better news about vaccines, including a rollout today with a wonderful emphasis on our school employees. Joining with me is Susan Mullaney, executive of Kaiser Permanente, CEO here of Washington. She'll have remarks later today. What we are announcing today is the Get Ready plan. As many of you know, everyone has been working very, very hard in this state to coordinate vaccines now that they're coming into the state. I want to start with a huge thank you to all of our educators, and I mean that term broadly, from our classroom instructors to our paraeducators to our building administrators and bus drivers and food staff. You've all been incredible in trying to put your best foot forward for our young students. We know that getting kids in classrooms is fundamentally the most powerful and equitable way to restore the great learning that is inherent in our system when we are at our best. I want to thank the chairs of the House and Senate Education Committees, Chair Santos, Chair Wellman, and the ranking members, Ybarra and Hawkins. They were instrumental in continuing to make sure the legislature's values were put forward and trying to move educators a little further along in terms of the vaccine timeline. What culminated here was flexibility by the governor and the Department of Health, and we thank them so much. Thank you to Governor Inslee for recognizing that the safety, the life and death safety of our citizens based on the data really compels 65 and older to get the vaccine in the current phase. And nothing we announce today will jump over that. Consistent with the plan and the phases, we are announcing today the Get Ready program. It will allow Kaiser Permanente as a tremendous partner to utilize incredible assets across the Puget Sound region in Spokane, including additional locations that we will partner with Department of Health on, potentially Kaiser and others, to ensure we get full coverage of our educators for vaccines as soon as our moment is a green light from the Department of Health based on the phase schedule. I remind everybody that this is a function of the vaccine for sure. We want more supply. The governor's been working hard to get more supply in the state, and we expect those numbers to continue to increase. I will also say clearly to everyone watching today, if you are a public school employee or a private school employee who currently qualifies, you are 65 and older or in a multi-generational family, we think that's 7,000 folks or so, please get your vaccine scheduled immediately. The more we can get vaccinated now in this phase, the faster the next phase will go when we open this up to all educators. The opportunity here from our partner is all public and private school employees, roughly 143,000 or so public school employees and roughly 12,000 private school employees. Again, we're not jumping the process at all. It's consistent with the current approach. But in phases B2 to B4, we know that more people are now eligible thanks to the governor's actions. But consistent with that, they are seeking efficiency of the vaccine. And we think this opportunity from Kaiser to create really meaningful and dedicated capacity for school employees will make more efficient the ability for all of our school employees to get the vaccine and not stretch that out over months, but rather as little as weeks if we can be super effective at this. There's a ton of work coming ahead of us, but with 14 to 20 assets around the state, Kaiser has incredible facilities, a relationship with DOH, a pipeline to vaccines, and a real focus on helping our school employees so that we might open quicker. I would also add to the conversation here, additional detail will be coming following a release here during or just after this event. OSPI will also build a page on our website that will be front and center for all additional information for vaccine. And I would ask everyone to be patient. Despite wanting to go immediately, what we're looking at is the fundamental reality that the current phase is about 1.5 million people. And based on DOH's recommendations, we can start the phase 2 through 4 segment of this when half of all people in the current phase get their first dose. That still means 650 to maybe 750,000 doses. So we are preparing as if we can go launch in about 4 weeks. It's probably more practical to think about this as 5 or 6 weeks away, but we know we have to be ready. And that's what the effort is here today. In short, we've got an incredible partner with statewide reach that's going to allow us to get almost immediately, when we are permitted to do so, as many as 70 but we don't exactly have the physical assets in place yet. It is our high priority, and you can expect additional announcements around that. Lastly, I have to say very clearly, this is a partnership with the governor's approach, but definitely getting us launch ready on day one when we get the green light, so that we are more efficient when that happens, so that we can get all of our employees vaccinated this spring, and candidly, to get schools open. The partnership I'm talking about is with local schools and local labor organizations who need to continue to push forward right now to open schools safely. People need to start thinking about the vaccine not as the trigger that allows that, but rather one more backstop. Here's the honest truth, everybody. 20 or 30% of our peers in the state don't want the vaccine, or won't take the vaccine, or medically can't take it. The vaccines are 90 to 95% effective under the current strain, so some folks are still at risk. Our students won't get this for quite a long time based on all the current clinical trials and the expectations around that timing. There are variants that are causing current manufacturers to think about booster shots and tweaks to the current vaccine regimen to try to create the most safe and effective outcome for our communities, even as this virus continues to mutate. The bottom line is, a vaccine is a tremendous safety net, but it is never the thing that's going to create the perfect scenario. Our schools are safe today when they follow the protocols in opening, particularly K-5, because the health profile of young people is so very different than the health profile of adults. Thank you to all the school personnel, all the educators who have worked hard at the local bargaining table to get schools open. It's happening at an accelerated rate. It's happening all over the state. Again, we do not have to wait for vaccine for that to be a process that can be engaged in today and open safely today if we follow the safety protocols, most specifically the face covering. That is becoming the absolute critical element in all of the work. So keep pushing through that, continue to open schools, think of the vaccine as a safety net that then accelerates all of our opening, but be relentless in your process right now about school openings. Treat the vaccine like it's one more significant safety protocol. And finally, just to be super honest, because that is what we are always trying to do about the facts around this, because of the fact that this vaccine, the current two in process and others coming on board, won't get to everybody because of personal choice, medical conditions, because we don't have one yet for youth, and because there are variants out there, we're going to be wearing face coverings and operating these protocols in our schools for quite some time. So one of the takeaways I hope you will have is that when we are launch ready in 4 to 6 weeks, we will expedite vaccines for educators as quickly as we can within the protocols established by the governor and the Department of Health. But that does not mean we are done with all the safety protocols in schools. Until everyone can get a vaccine, including all of our students, we will continue those protocols in our classrooms and our buildings. But the opportunity here is significant, and it's the fastest progress that we can make right now to get schools open, consistent with all of the health and safety standards. With that, I'm going to turn it over to Susan Mullaney, who's just been an awesome partner. I will tell you that when we finally got the clarification on where educators could land in that phasing, and the governor accommodated some more flexibility, my first call was to Susan and her team because of the scale, because of the assets that they have, because of the expertise. They have absolutely done everything they can to make this possible, and we are incredibly thankful for their work. Susan, I'll turn it over to you.
Thank you, Superintendent. And I'd like to start with this. You know, there have been many heroes throughout the pandemic. And our teachers and our school staff, they are a special kind of heroes in my book, in Kaiser Permanente's book, and not just during the pandemic, but long beforehand as well. So that's why Kaiser Permanente, we are so deeply honored to be the healthcare partner standing up a plan in support of Chris, and you hear his passion, and all school employees to vaccinate our school teachers and staff and get our kids safely back to school. We all understand the huge importance of protecting our most vulnerable population during this pandemic, especially our kids, for whom schools are a central support to their overall health and well-being. So we'll be lending our scientific, our medical, and our operational expertise to this entire effort. We know how to run mass vaccination sites. We're well underway with vaccinating our membership according to the state's phases. And now we'll be expanding our capacity to be ready to offer vaccinations grounded in safe and equitable planning to school teachers and staff throughout the Puget Sound region and in Spokane when we move as a state into the next phase of their eligibility. This covers about 80% of school staff, and of course, any school employee is welcome at any one of our many vaccination sites to receive their vaccine doses. Our Kaiser Permanente doors are open to all of you. I think I'm going to speak for a lot of people when I say this. Many of us with school-age kids, myself included, have had a front row seat watching our kids learn from teachers online at home. And it has just been incredible, incredible to witness your passion and your dedication in action, especially when the chips were down and you had to pivot so quickly. What you do every day for our kids is so inspiring and humbling. That was pre pandemic, that's been during the pandemic, and that will be post pandemic. On behalf of all of us at Kaiser Permanente, I want to thank you for making such an incredible difference in our kids' lives and throughout our entire community. I'd also like to thank Governor Inslee for his incredible continued leadership. Thanks to him, we have a unique and powerful public-private partnership stood up across the state, working hand in hand with the Washington State Command and Coordination Vaccine Center that he established just a few days ago. Those two important mechanisms, the public-private partnership, the Washington State Vaccine Command and Coordination Center, run through the governor's office by Dr. Shaw and all of our public health leaders, that will serve as the backbone for this effort that we can plug into now as we move very quickly to have a plan in hand to be ready to vaccinate all of our school teachers and school staff when the time is right. Finally, I'd like to thank Superintendent Reykdal. He is an amazing leader who is so dedicated to kids throughout the state and all the teachers throughout the state. I want to thank our educational leaders and our employees across the state, and importantly, our state and local public health leaders and workers who've had an unprecedented task put before them. Getting our schools safely and equitably vaccinated will be our collective passion project. And now we're ready to get to work and get our kids back to school. And Chris, I just want to thank you and I want to thank the governor for giving Kaiser Permanente the opportunity to serve in this capacity. So back to you.
Thank you, Susan. Really appreciate your partnership. We're going to turn this over here to some questions. Let's make sure we speak real loudly so we can hear those, get some answers to those, and we may go back and forth between Susan and I on those questions.
Okay, our first question is coming from Casey Decker from Creme 2 News. Casey, I will unmute you now.
All right. Yeah, my first question would just be, when it comes to teachers arriving at these sites once they're there, what sort of verification is there? How do you make sure, I guess, that these people are in fact teachers?
Great.
Lead off with that. What a great question. Maybe we should put you on the planning team. Sure. So be careful what questions you ask. We might employ your help. Those are all the details now that we've got to work out as we now get to work on establishing the plan. I can tell you, having been at this now for a while, it's all those critical details that need to be worked out. And I've no doubt that we'll be able to move through that level of detail very quickly so we can start to offer Chris and schools clear answers and start to inform people about plans and also get their questions, input, and advice along the way as we work with all of the schools to create these plans. Chris, I'll turn it over to you to add to that.
Yeah, over the next 4 weeks, we'll continue to communicate on a very tight frequency with school districts, public and private, around the state on what that looks like as Kaiser continues to build out the connectivity to educators, whether it's the scheduling process, the verification process, the locations. There is a logistics to this that are so critical. That's the final set of details that we are going to be putting together with them, again, over the next 3 or 4 weeks. They've got expertise in it. It's why we've turned to Kaiser. And now it's a matter of matching up our data with theirs to ensure that when an educator of any form in our schools jumps on that and says, I'm registering and I'm signing up for my vaccine, that's as smooth and as seamless as possible and follows all of the safety and privacy protocols.
And then I'm assuming in that case, if the logistics are still being worked out, that we don't have a sense yet of, for instance, where in Spokane some of these locations might exist. Do you have any idea, though, would it likely be in school buildings or would it likely be at Kaiser facilities? Do you have any sense of what the kind of locations could look like?
Yeah, I'll start and Susan may jump in. The strength of this partnership is they already have owned and operated assets in Spokane County, up and down the Puget Sound, that we can get access to. For those north of the Everett area, we'll come to that. The folks west of the Puget Sound will come into the Paulsbo area to Kaiser facilities. Folks south of Olympia can come into the Olympia area clinics of theirs. So primarily Kaiser assets, and we are mapping as we speak right now some locations where they don't have a physical owned and operated asset, where between the Department of Health, Kaiser, us, or other partners, we will potentially use school sites. We've got the addresses now, we've got a mapping system that we can utilize, and we're going to figure out those voids. And it may be that some school districts are going to get a call and ask to be host of clinics. But we've got to figure out the rest of that mapping. Susan may want to speak a little bit to activities in Southwest Washington as well.
Yeah, I think that you covered it all really well, Chris. The only thing that I would add is that we, of course, have a large presence in Southwest Washington with our Kaiser Permanente Northwest team. They're all in on these plans, and so we'll be setting up vaccination strategy there as well for our school teachers and school staff, and more to come shortly on exactly what those plans look like. But we've got many owned and operated facilities in Southwest Washington that we're going to put to work for this effort.
Thank you, Casey.
Thank you, Casey. Our next question comes from Joy Resmovitz from the Seattle Times. Joy, I'm going to unmute you now.
Hey, thanks for taking my question. I wanted to ask if you had any more details on how exactly the distribution is going to work. Will you be primarily employing healthcare workers from the Kaiser system, or will school nurses be involved? And I also wanted to ask if there's been any labor agreement involved in setting this whole thing up. Thank you.
Great. Let's go to Susan on the logistics of their staff and how they'll be utilized, and I'll take the back half of that.
Yeah, thanks. Great question. 3 important ingredients: sites, people who can vaccinate people, and also all the people that need to support that effort, and also, of course, the vaccine itself. So this is going to be an effort that takes a village. What we are doing is we are providing all the planning efforts. We will be staffing these vaccination sites. If we don't have enough staff, if we don't have enough people, we'll certainly depend on our fabulous healthcare partners throughout the state, who I'm sure would be eager to sign up for this particular duty, no doubt about that. And if we need to, we can certainly have an easy, quick process to facilitate other types of volunteer activity as well. So all that work is underway as of today. And so I've got no doubt that we'll have enough people in the right places to pull this off. Now we'll just need the right amount of vaccine, and we are optimistic that with all of the efforts underway to get vaccine ready and then distributed across the country and to the state and throughout the state, that we'll be in good shape to reach the goal that Chris described. Chris, I'll turn it back to you.
Great, yeah. So obviously the labor organizations in the state have just been a tremendous partner in helping us understand the importance and the needs from their member perspective. They are aware of this effort. And what I want to remind all folks about is this is multiple layered. In other words, Kaiser's creating another opportunity. There are other things in place already and being worked out where other providers are equally creating expectations of their staffs to support educators in their vaccine efforts. So nothing about this is exclusive. That's one of the great things I appreciate about Susan is this is about getting vaccinations and safely reopening schools as part of that effort. But there are other efforts underway, no doubt, and we support those as well. So educators will have multiple opportunities. It still might be their local healthcare provider. Certainly Kaiser and all of its assets and geographic reach will be an option. And candidly, when the phases are appropriate, educators can reach other channels as well. We know there are national partnerships with some chains and others. Those will all still be available. The bottom line here, Joy, is if you are currently eligible, go get scheduled for your vaccine so we get through as much of that pipeline as possible. That shrinks the numbers in the next phase when we go. Kaiser will be a great asset to this, but we'll continue to work with the labor partners and all the school districts so they know of all of the opportunities available to school employees.
Thank you, Joy. Our next question comes from Chris Daniels from King 5.
Hi, my question is actually for Susan. As you're aware, Kaiser had a freezer failure last night that caused quite the scramble for people to get the vaccine after midnight. My question is that a sign of a bigger issue for Kaiser? And also, what's your available vaccine on hand right now, system-wide?
Yeah, so we've been into this situation now for a year, and the team has done exceptionally well. We've already set up mass vaccination sites, and we've done that exceptionally well. We've vaccinated 30,000 of our own members and our own people to date. We've got 17,000 more people who will move through vaccinating over the next several days. When that refrigerator, it was a refrigerator that malfunctioned yesterday at our Capitol Hill site. When that happened, there was an immediate response to that, including reaching out to our other really strong healthcare partners in the community, the University of Washington and Swedish, to say we've got to get these 1,600 doses into people's arms in the next 12 hours. Let's make that happen. And we made that happen by 3:15 a.m. in the morning. We've tested every refrigerator, every freezer. They're all functioning properly this morning. And on my desk this afternoon, before the day is out, I'll have a full after-action debrief to let me know if there are more systematic issues. I don't think that will be the case, but if it is, we'll know it. And then furthermore, we'll be working with the state to make sure that those lessons learned can be fully understood and debriefed with other healthcare providers, because I don't think that that's an issue that faces us alone, so that we're well prepared to be ahead of managing that as we move forward with more and more vaccinations throughout the state.
And in terms of your overall supply right now, system-wide, because that's obviously a question here when you talk about just how soon teachers may be able to get the vaccination.
Sure.
People that want to get inoculated.
Yeah, so we've done a great job of putting every vaccine dose we've been given to work since the get-go. We've got 17,000 doses on hand right now that we will use now over the next several days to get our members vaccinated. And now what we're waiting for, frankly, is just more vaccine to come our way so that we can move through this phase of vaccination. So that's a week by week allocation that we get. And as soon as we get that vaccine, we'll put it to work. So like I said before, what we're doing is we are setting up the plans so that we're well poised to vaccinate all school employees who need to get vaccinated when their turn is up. And in addition to that, we'll continue to vaccinate all of our eligible membership and employees as their phase becomes eligible, and we'll move through it. Now what we need is the vaccine. So we've got the plans. We'll have people in place. We've got the sites in place. We've been at this now for the past several weeks. Now we just need vaccine flowing from the federal government to the state and then to us.
Thank you.
Thanks.
Thank you, Chris. Our next question comes from Jerry Cornfield from the Everett Herald.
So just to follow up on that last point about the flow of vaccines, I wondered if Superintendent Reykdal, you could tell us, has there been any agreement with the state that when the time comes for teachers that a larger percentage of doses will be directed to this effort? I know earlier this week he had noted that mass vaccination sites were getting 45% of the state's allotment. So I'm wondering if you have secured a commitment to get a larger share for a short period of time.
Yeah, no, not specifically, Jerry. Thank you for the question. We are going to be super consistent with the Department of Health framework on vaccines and phases. The flexibility offered is that in phases B2, 3, and 4, rather than stretching out school employees for months and months, there is an opportunity to go faster, particularly, as Susan said, if the vaccine comes along. Those other facilities will continue to get vaccine share as well. So again, there's options many ways, and we're not skipping over folks. If you are 65 and over now, you are eligible. When the phase comes in 50 and over, those folks will also have access to vaccine. Folks should think about this as not having educators scramble to know where to go, but to efficiently know exactly where they can go to get vaccine before we get the green light. And then obviously the logistics of the Kaiser team is to get that scheduling process underway so that when educators are given the green light, it's very, very efficient, and we don't take months to do it, but we shrink that time dramatically. But we, at this point, it's not our role to secure any particular volume. That's consistent with the larger DOH plan, so that it's geographically equitable, so that the phases are honored in the governor and the DOH plan.
And just one follow-up, if I could. I'm just wondering, there's a lot of listening to a lot of effort to plan, but why did you not just set it up where you made appointments and go school to school to school? Under the phasing, it is possible to vaccinate every employee at a school, regardless of their age and the situation, under the phase 1B, tiers 2 through 4. So why did you opt not to just make appointments and send mobile teams out to every school?
Yeah, I'll start, and then Susan undoubtedly has more intel about the larger state obligation expectation. There are phases that have to be followed, obviously, based on DOH. Our governor has made a very important point of prioritizing 65 and over in this first phase, the one we're in today. It is saving lives. We are 2.4% of the U.S. population in the state of Washington. We're only 1% of the loss of life. Our governor has prioritized this as a life-saving a sense of priority. So we certainly wouldn't jump any of that. And then there are significant logistical challenges of getting any site authorized and approved by DOH. As you might imagine, some of this, based on one of the providers, has to be stored at extremely low temperatures. So the capacity to do that isn't very easy. And we have 2,400 schools in the state, 295 districts. It isn't very practical to go school to school. It would be, unfortunately, longer term, less efficient given the logistics. And we really couldn't say right now, DOH guarantee us X number for this school. It doesn't quite work that way. It works better to have a partner with the infrastructure of Kaiser with set locations and have folks come to that partnership. That, we believe, is the most efficient way to do this, consistent with those phases. Susan, you may have more.
Well, Chris, you sound like a healthcare expert, so it's tough to follow that act. What I would say is that there is a lot that goes into making sure that this process works effectively and safely for every single person involved who's doing the vaccination, as well as for all of the people who will be moving through vaccination sites to make sure that it gets done in the right way. So we have a lot of school teachers and school staff who will need to be vaccinated. There is just a lot of logistics to make sure in place and working seamlessly, from getting online to schedule a vaccine, getting registered for that, tracking that through the state registry under Dr. Shah and our DOH team. Then there's the clinical and the medical personnel who you need on site to make sure that vaccines are given in all the right ways and all the safe ways. So there are a lot of logistics to be planned for, to be worked out. Like I said, we've got a lot of experience with that to date, and so this should be relatively easy for us to work with Chris and all the schools to map out exactly how those logistics will work consistently and reliably, so that we can make sure that we get all of our teachers and school staff vaccinated as safely and effectively as we can, and also equitably. That's a key part of this as well. So it will be really beneficial for our schools to have one plan that serves that ultimate goal of getting our teachers, staff vaccinated and getting our kids back to school.
Yeah, and that said, I'll just add again, Jerry, it's a very powerful point. There may be some geographies that just aren't suitable given the drive distances to these physical assets that Kaiser's offering. So we may need some school facilities, and we're kind of mapping that out right now. So it could be that some school sites are necessary. If that gives us the most efficient way to deploy and the most rapid deployment of vaccine, we'll do that.
Thank you for the questions, Jerry. Up next, we have Keith Eldridge from Como News.
Thanks for taking the question. Is there any consideration that you needed to ask the governor to actually move teachers into phase 1B1 and have all teachers not right now be eligible for vaccination? And if not, was there a consideration of holding off on urging people to go back to in-school learning until after all the teachers are vaccinated?
Yeah, thank you, Keith. You know, I've had the conversation with the governor and his team. Like legislators, we wrote a letter, you know, asking that educators move higher up the priority list. But I want to be really clear. This is a governor who made a decision about life and death, and he made a choice that the best way to save lives is to focus on 65 and over in the current phase, and I respect and honor that, and we will honor that in this process. What was provided is flexibility so that we didn't stretch out educators over 3 or phases, so that we were still not getting to some of them till May or June. That process can go much faster under this and still respect the phases, but the governor made a decision. It was about who has the highest risk profile and the highest risk of a loss of life, and that's what he's prioritized. And we all need to honor and respect that and work within that framework now. That's what we are doing. So I think that captures it, Keith, but at the second half of your question, you may want to repeat here if we didn't grab it.
No, you got it. As far as holding off until teachers have been vaccinated, that was
right.
the second part.
Again, you just heard again from the CDC this week and Dr. Fauci. They have put this question through tremendous research internationally and nationally, and unequivocally what keeps coming back from the public health community and the pediatric community is that this is a complicated set of variables, but on balance, given the health profile of typically developing kids, there is a way to come back to school safely short of a vaccine, and we've been doing it all over the state and all over the country. I think our state's done some of the best work here because we put those programs in place in June. Our districts have known since June exactly what they have to follow. So for the districts that have opened, some of them have been open all year to their students. They've done this very effectively if they follow the protocols. It is not absent of some breakouts. And remember, a breakout is 2 or more cases in a school of unrelated siblings. Or people, so a breakout isn't particularly 30 or 40. It's 2 separate kids get the vaccine, get the virus, and then there's protocols in place, obviously, to quarantine and contact trace. So just an absolute thank you to the districts that have done that. We need to be opening our schools right now, so it is not a wait until we get a vaccine. I know there are folks and organizations who disagree with that and they want to wait. I respect their opinion on that. The science says to us that on balance, given the isolation of kids, the academic and social emotional risks, the faster we come to school, the better. But we got to follow those safety protocols. Those are in place. Districts should keep planning for that. And again, I challenge local education associations and administrators to stay at the table and get schools open and think of the vaccine as an ultimate safety net here, or a near ultimate safety net, but it has no certainty of perfection, and therefore, under any scenario, face coverings, open schools, then get the vaccine.
Thank you, Keith. Up next, we have Brian Flores from Q13 News.
Hi, Superintendent, can you hear me?
You bet. We got you, Brian.
Okay, thank you. I appreciate taking my question. My question is more directly towards you, and you did talk about it just now. But when we talk about, with districts reopening, especially for younger learners, we're talking about like school districts like Bellevue right now. Issaquah is going through that as well, negotiating on that end. And when you talk about 4 to 6 weeks of getting this vaccine out, do you ideally, just in terms of timeline, believe that schools will reopen, should reopen within that time frame? Talking about 4 to 6 weeks when teachers do get the vaccine?
They really should, and I hope I'm being clear about this. They can, and they can do it safely, and they should. Again, particularly for K-5, that is based on medical science. They are much less likely, that age cohort, to get the virus. They are much less likely to shed virus and therefore spread it. Again, it is not without risk, and unfortunately, every year we have a loss of life of some students and staff to virus. And so this is not about overstating how easy that is, but they can and they should move forward. And I know folks will say, well, let's just wait for the vaccine. That isn't necessary. You can open safely, and you ought to be moving towards that. And again, I reiterate once more, if your mindset is the vaccine is the thing that ensures safety, just understand that is not an accurate portrayal. Lots of people won't take it. It's 90 to 95% effective, which creates risk. There are variants coming that are going to cause booster shots. Our students won't get the vaccine for quite some time until it gets through clinical trials and approval by feds. So you can't say until we get a vaccine and everyone gets 2 doses, that's the only way to safely open schools. That is just unfortunately not true. But the vaccine makes possible a significant protection and safety layer that will increase our safety concept in our schools. But today, work on your openings, stay on track to do that, particularly K-5, where the health profile is so different than high school or adult kids. But again, anybody can open if they can meet the safety protocols.
Thank you, Brian. Up next, we're going to Sally Ho from the Associated Press.
Hi there. The first half of my question is easy, which is the state paying for Kaiser service in this program? And the second half of my question is, Superintendent, you said you respect the teachers not wanting to go back without a vaccine first, even though you think they should go, that it's safe now for them to go back now. So I mean, are we simply accepting that there are just going to be protracted battles between the unions and the districts, and that a significant segment of teachers will not return this year?
Thank you, Sally. Let's take them in order. There's no payment from the state to Kaiser for this. Susan may want to talk a little bit about how providers get refunded, and this is paid for by federal dollars. So let me pause before we get into the other question and see if Susan has insight on how their model works.
Thanks, Chris. There is no payment from the state to Kaiser Permanente for doing this. We're doing it because we know how important it is to support our schools throughout this pandemic. It is set up so that if any school teacher, school staff member is already a Kaiser Permanente member, then they've got access to the service free of charge no matter what. Any non-Kaiser Permanente members coming through will be able to bill their insurance companies or the federal government to get reimbursed for that in all the routine ways. So we don't see any problems with how we've set up this program to move forward with Chris in the schools.
Sally, the second half of your question is kind of the complexity of our state and how it operates on these questions. I've been really clear that neither the governor nor the state superintendent or even a health official can make schools return to in-person learning. That is a very, very relationship-based environment of local relationships, generally MOUs or full bargaining agreements. That can only legally happen by school districts right now locally. So that's why I say they've got to stay at this and focus on the science. You can't like the science when it's said in the spring, close down until we learn more, and then say you don't like the science when it's really clear that you can do this safely. So that's the point here, is folks really need to focus on the science. I understand when I say I respect, I know there are different perspectives on this, but we got to get out of social media as our source of information and get to the CDC, get to pediatricians, and get to clinicians who are abundantly clear you can open school safely if you follow the protocols. And while there's no perfect system and there's still some risk, on balance to kids, given the isolation and the academic impacts, the social and emotional impacts, on balance, they're telling us that's the way to go. And that's what I would expect labor leaders and school leaders to continue to move forward with. But they're going to figure this out on their own. And so, my honest answer, and I've said it before, is they may conclude that they're not going to do that. But that is a choice that they have made locally because they couldn't get to that agreement. And that's the way this state works. I know it is frustrating for folks, but if you really respect the employer representatives and the employee representatives, that's how it works here.
Thank you.
Thanks, Sally. We are going to go back to Casey Decker from KREM 2 News for a second question.
Great. Yeah. Is the expectation that these Kaiser clinics will be the sole provider of vaccines to teachers, or will there likely be other sources, general mass vaccination sites like we're seeing now that teachers could go to, where maybe, some of them choose Kaiser, but some of them still choose to go to the Spokane Arena or something like that?
Casey, Kaiser's provided this great opportunity so that everyone in the education system absolutely knows there's an access point for them, but it's not exclusive. The mass vaccination sites, assuming you're in the appropriate phase, are available to you. In the appropriate phase, individuals can go to their own providers if they have access to vaccine, and that's a possibility. We have national change under contract with the federal government and some in the state that are ramping up. All those will be options for anybody. What we wanted to do is make clear to educators we are working hard to expedite a process that in the next 4 to 6 weeks, when we get the green light, we are going to be ready. And it isn't then about saying, I wonder where I should go to get a vaccine. Our teachers and our school staff need to know right now a plan is underway and is going to be executed effectively. So when that day comes, you at least know you've got a Kaiser option or one of the partnerships we make in a community where there isn't a Kaiser asset.
And then real quickly as well, we just saw in this press release, the expectation was 14 to 20 locations all told. Do you have any sense of how many of those would be in Spokane County?
I'll let Susan answer.
Yeah, Keith, so we've got good coverage, good sites in Spokane. So we've got 5 locations that we can use there. We'll figure out which are the right ones to put to work on this front. And then if necessary, we can also partner with others in the community. The point that Chris makes too is the right one, which is this provides all schools a great option, a guaranteed option to use Kaiser Permanente if they need to be vaccinated. It is not exclusive. So if districts have different plans, those will remain as options. People with individual providers whom they might want to get vaccinated by, that's still an option for them. And we will have Spokane well covered.
Thank you.
It looks like that is the end of our media questions. So Chris, if you want to wrap us up and close us out here.
Yeah, thank you again for everybody for tuning in. Just really appreciate the partnership with Kaiser. Again, thanks to all the advocates who know so powerfully the opportunity here to focus on the life and death safety of our citizens. Thank you to the governor for making our most at risk a priority, but then creating the possibility for us to be more efficient with our school employees. This opportunity will expedite vaccines when our time comes. We will be ready from an infrastructure standpoint. There'll be multiple options for all of our school staff, public and private. The goal here is to return to school safely. This underwrites existing practices that allow you to do that today, but this really underwrites it. But again, we're going to get vaccinated in this state, and we're going to do it well. Unfortunately, vaccines don't create a guarantee, particularly with variants that are out there. And thank you so much to the manufacturers who are thinking constantly about being ahead of that curve. Always ask for grace. That's a word we established here as our framework at OSPI in all of this, because there is no playbook for a once in 100-year pandemic. We have all moved together as Washingtonians to try to figure this out together. This is the next phase of that, and I cannot thank enough the Kaiser team for their support, for putting forward just incredible thinkers on this, building the infrastructure behind the scenes, and essentially saying when that phone call was answered, whatever it takes to get educators and schools vaccinated safely so that kids can get back to in-person opportunities. Thank you, Susan, to your team. If you've got any closing remarks, we'll take them now, and appreciate everyone being here.
Thank you, Chris. I want to thank you for your incredible leadership. And again, we are just, we're delighted and we're humbled and honored to serve in this capacity. So lots of work to do. And the entire team at Kaiser Permanente is so excited about leaning in to help out our schools. So thank you.
Thank you, Susan. Thanks to everybody. Stay tuned. OSPI will build a web page dedicated to this, where ongoing information will go on that, including every step of the way with the Kaiser partnership. Appreciate all of your work, and thank you to school employees across the state for all the work you're doing to support our students.